first part, we'll be talking about part 1 of the introduction section. The second part will be part 2 and part 3, both in 10 minutes. And we will have a bit of general tips and tricks in the first part of the introduction section. Okay, so in the beginning, I just want to highlight that there are a lot of common untrue quotes that we hear every day as medical writers. So when we talk with fellow writers and colleagues, they always mention that reviewers don't stress on the introduction section and that nobody reads it at all. And a lot, when we ask them why the introduction section was poorly written, they say that they do not waste much effort and time on it. And even some say that they could not find anything new to say, and that their topic is a trend now, and every time they want to write something, they find it in previous writing. So I just want to highlight that these quotes are untrue. Reviewers do read the introduction section, and believe me when I say that when they see a good and strong introduction section, that gives them the urge and makes them want to read more. However, on the other hand, when they find an introduction section that's poorly written, whether in context, whether in flow, whether in grammar, language, that's a major shut off for them, and a lot delay the review, or even if the readers are not reviewers, they do not complete reading. So the introduction is really important. There are 3 main questions we want to ask. Why do we need an introduction? Why not jump to the methods section right away? And does anyone actually read the introduction? So the answers are, why do we need an introduction? Because a good beginning urges the reader to continue reading. If you see an interesting start, you will be enthusiastic to complete your reading. And the introduction familiarizes the reader about the background information. So the first thing that attracts a reader is the title. So if I feel that the title is relevant to my work and what I want to read about, I go in and look at the background information in the introduction section. And I want to know what this study is about, and I want to know why this research topic is important. So if I find the answer for these 3 questions relevant to my work, I will complete reading this paper. So should we jump to the methods right away? No, we have to put an appealing beginning in the beginning of the manuscript so we can complete reading and attract the readers to complete reading. Does anyone actually read the introduction? Believe me, yes, yes, yes. Reviewers read it, readers read it when they are interested in this topic. So it's all about becoming a good storyteller. So writing is tough and it needs practice. And when I say tough, it doesn't mean nobody can do it. Anybody can learn the skills of medical writing. However, you will not be a perfect writer from the beginning. And it will take a lot of practice to become a good storyteller. So when you're talking about the introduction, you have to mention 3 things, and we will get to say them in details now. What is known, what is unknown, and how you will fill the gap or the unknown part. So it's all about taking the reader through a journey, and it should be a pleasant journey, and it should be a fun journey and easy to digest. Beginning with the background information, then going through the gap analysis and the current situation, going to your hypothesis and research goal, and stating the outcome of your work that will add to this scientific committee. On a side note, I just want to highlight, please, please, please don't write for the sake of writing. Don't write unless you are adding real value to the scientific community. Ask and make sure your research question is needed, because this will increase the reach of your work. So part one of the introduction section. So we mentioned that the introduction is 3 parts, mainly the background of the problem, and then the existing research, and then the problem statement. These are the 3 main parts of any introduction section in any manuscript. So first part is the background of the problem. You have to mention and just briefly talk about the disease area that your problem is included in. Is it a disease area? Is it a certain problem field? It could be something else rather than a disease. For example, a field in microbiology, in a field of devices, in a field of AI, anything, just conveying the background of the problem you are going to be talking about. So the objective of the first part of the introduction section is to provide sufficient background information by highlighting the current understanding in the field. So I found this figure on a website, and it's really good. And it mentions that there should be a hook in the beginning. So you should attract the reader with a statement that's very appealing and directly to the point. So I'll give a couple of examples of what good looks like as a starter for an introduction section, and what, from my experience, feels like an introduction that needs more work and more effort. So this study, for example, is on adalimumab efficacy in patients with psoriasis who received or did not respond to prior systemic therapy. So they began their introduction with a very interesting and strong start. They mentioned that current treatment guidelines suggest that psoriasis may be treated with topical, UV-based, traditional systemic, or biologic therapies depending on specific patient and disease characteristics. So they are broad. They are talking about the treatment guidelines of psoriasis in general. It's strong. They did not begin with boring introductions, like, for example, definitions. So they didn't say psoriasis is an autoimmune disease affecting the skin, and this is, they didn't start that way. They highlighted on a broad yet specific introduction, and that urges the reader to know, to want to know what's next. Then they took us to the second statement, which is describing the current management situation. They mentioned that the majority of patients with psoriasis who are prescribed biological therapy or biologic therapy, so the smooth transition from the general treatment paradigm, then sliding to and focusing on biologic therapy, have previously received treatment with other systemic therapies, including MTX, cyclosporin, and PUVA therapy. So general, then more specific on the guidelines. Then they further directed the readers in the introduction to the value of the study. And they mentioned that it is of clinical relevance to understand whether patients who have received prior systemic therapy, especially patients who did not respond to previous treatment, will respond to biologics to the same degree as patients who are naive. So they are stating the objective of the study as a result of the current situation gap. However, if you look at this introduction, you will find that it's quite irrelevant to the topic. So what's the topic? What's the title? The topic is randomized controlled trial of adalimumab in patients with non-psoriatic peripheral spondyloarthritis. So it's an RCT, the treatment is adalimumab, and the patients are non-psoriatic peripheral spondyloarthritis patients. So how they started is they talked about that SPA, or spondyloarthritis, refer traditionally to a group of interrelated diseases, which includes ankylosing spondylitis, psoriatic arthritis, reactive arthritis, inflammatory bowel disease, and undifferentiated SPA. So, from my opinion, this is indeed a broad approach. However, it's irrelevant and it's not interesting because he's stating, or they are stating, all the diseases under SPA, and that's irrelevant because we already mentioned the type of patient we are going to talk about. So it's only just be general about that type in specific rather than stating all other types. When they completed talking and tried to be more focused, they talked about that the assessment of Spondyloarthritis International Society developed and validated updated classification criteria for SPA on the basis of predominant clinical manifestation found in these various SPA disease subsets, classified as either axial or peripheral SPA. Again, they are trying to narrow it down and be more focused. However, focusing on the classification criteria of SPA is totally irrelevant to our title, which is, again, randomized controlled trial, an RCT on adalimumab in patients with non-psoriatic peripheral spondyloarthritis. So you can see that it's quite irrelevant to the topic. And if you read the rest of the introduction as well, also it's quite irrelevant, and they took much time to reach the goal that they want to reach in the introduction. So, regarding the first part of the introduction, there are some tips and tricks. Always begin broad, then narrow down. Use the funnel approach when writing your introduction. So begin general and narrow down to the specific topic. So if you want to talk about the prevalence of diabetic ketoacidosis, for example, in a special population, you begin talking about diabetes and then narrow down to DKA. The second thing is use an interesting start. So catch the reader's attention with a strong general statement. And I like to call it a killer hook. Just grab him with this statement. And please, please, please do not use boring repeated statements. So for example, in the last year, we've had a lot of papers written in COVID, of course. So the most common statement that we see every day was that COVID-19 was discovered in the city of Wuhan, China in January 2020. This is a very, very repeated and boring statement to start with. And even one of the journals and one of the reviewers specifically asked that this introduction should be changed because it is repeated repeated too much, actually. So begin broad, narrow down, interesting start, and use statistics and numbers. Numbers are very good attention grabbers. So use facts based on numbers, support your scientific claim, and numbers give your claim more credibility. So for example, if you say that 20% of ulcerative colitis patients in the MENA region receive biologics, you are grabbing the attention of the reader. So this is a major issue in the MENA region, for example, and this percentage could be high or could be low of patients receiving biologics. So I'm interested to see what more this paper will say. And please take care about definitions. A lot tend to begin their introduction sections with definitions. Please, if your disease area is well known, do not begin your introduction with known definitions. So for example, rheumatoid arthritis is an autoimmune disease affecting the joints and. This is a very uninteresting definition that shows that there is a lack of excitement in the first statement that may reflect on the rest of the study. However, new areas could need a definition. For example, if you're talking about precision medicine, which is a new era in managing, for example, oncology and cancer, you should first define what precision medicine is. For example, if you're talking about rare diseases like Menkes disease, not a lot of readers know about it. So you should also elaborate in a few words what is the definition of this disease, and take care not to over talk about definitions. So the second part of the introduction section is the existing research. So you've stated the general knowledge, and then you want to mention all the existing research related to your topic. So the objective of the second part is to state the current literature related to your topic, and always choose the data that help identify the research gap you are about to mention. So the existing research is a crucial part. I'm giving an example in another way. I found this article on PARP inhibitors in patients with newly diagnosed advanced ovarian cancer. So this is the second part of the introduction. So there was a first part and there's a following part, but the second part is stating the background of the disease they are talking about and the drug they are talking about. So for example, here they stated that targeted therapies are a new treatment option for patients with ovarian cancer. See how smoothly and generally and broadly they began. They talked about targeted therapies. So you know now that PARP inhibitors are targeted therapies. You know now that this is a new and rich area they want to talk and elaborate, and the study is related to. And they specified the population, which is ovarian cancer patients. Then they mentioned that PARP can prevent DNA repair in tumors with HRD, including those with BRCA1 and BRCA2 mutations. So they began to talk about the mode of action or the mechanism of action and the target of the investigated drug or drugs they are going to be talking about. So again, they started general, and then they focused on the mechanism of action and target of these therapies. And they focused on the population they are going to talk about, which are ovarian cancer patients with BRCA1 and BRCA2 mutations. The second part, they supported their scientific claims with evidence. And they mentioned that around 13% of ovarian cancers are caused by a mutation in BRCA1 and BRCA2. So they are highlighting the value of investigating this patient population. And they began mentioning that PARP inhibitors, including, so they stated the three drugs that they're going to talk about, which are PARP inhibitors, nariparib, rucaparib, and olaparib, have been approved as maintenance therapy for relapsed platinum-sensitive ovarian cancer patients, regardless of the BRCA status. So they are supporting the claim with existing literature and facts that help reach the research gap. And finally, they mention their research gap, that it is unclear if PARP inhibitors can improve the prognosis of patients with newly diagnosed advanced ovarian cancer. So research gap can be in many forms. It can be, for example, a limitation in existing data. There is no enough data in a certain disease area, and we're looking for more answers to more questions. There could be contradicting results in previous research. For example, drug X was efficient in a certain disease in some studies, and in other studies it did not show any efficacy, or it was not significant. So you are conducting a research as well to add to this contradiction. There could be variables also that could be improved, and you're trying also through your research to improve them. So Some tips and tricks also in the second part of the introduction section is always state the up-to-date literature. Please, 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 please do your literature search efficiently. Read as much as you can before writing. You have to be 100% sure that your data is up to date, that you are not putting outdated data. A lot of writers, especially freelance writers, if they are not experienced in this disease area, they just put the first data that comes in front of them. So please double check that your data is not outdated. Please seek advice from area experts. So if you have friends, if you have a mentor, if you have an expert that you know in this disease area, take their opinion and check if this data is up to date. And always use words to reflect that your information is recent. So use words like recently, words like during the last decade, for example, in the last 5 years, and other words. So when we look, we have to, when we review the introduction section, we look at the data and see that if it's up to date. For example, the incidence of breast cancer, for example, according to the latest Global Can registry, was 1 to 3. And when we look at the reference, we find that it's the Global Can, an old Global Can registry data, for example, maybe 10 years ago. And there are 2 updates after that data. So it has to be up to date. And please, another important part is do not overwrite this part. You will find a wealth of data when you're supporting your scientific claim. Do not overwrite it. Just choose and summarize. If you want to go with 3, 4 references, please summarize them all in one statement. Do not mention each reference and each data in each reference. So even if there's a wealth of data, do not overwrite, and do not forget, this is not a review article. We are talking about an original article manuscript that needs a concise introduction. So in a review article, that's quite different. You can elaborate more in the introduction section, in all sections actually. However, be precise and be to the point. And do not write long paragraphs about, for example, the burden of asthma worldwide, because you will find literally hundreds of papers talking about that. So you will not state all of them. You will just read most of them, read the updated one of them, and summarize in your own language. Do not copy and paste. Summarize in your own language. So the third part of the introduction section is the problem statement. So it's important to state clearly the problem and the objective of the study you're writing and the manuscript you're writing. So I'll also give a couple of examples from the literature. So for example, this study is titled Global Economic Cost of Smoking-Related Diseases. So what they did is that they described the objective and the impact and value of the study. So they mentioned that the aim, it's direct, it's clear. The aim of the study is to measure the global economic cost of smoking attributable or smoking-related diseases. These findings will highlight the need for countries to implement more comprehensive tobacco control measures to address these economic costs, and will also help achieving global development priorities under the SDGs. So they describe the objective and they mention the value and the impact this objective will have on the governmental level and the global level. Another way of describing the study problem or the problem statement is having it in steps. So, for example, in this study, angiotensin neprilysin inhibition in acute decompensated heart failure, they divided it into 3 parts. The first part that they briefly mentioned the research gap. So they mentioned that whether the initiation of sacubitril or sacubitril valsartan, which is Entresto, therapy is effective and safe. So they're talking about efficacy and safety among patients who are hospitalized for acute decompensated heart failure. This is the population they are studying. This is unknown. Okay, so this is the research gap. And then they went to the study objective after that. So therefore, as a result, they designed the Pioneer HF or heart failure study to assess the efficacy and safety of the initiation of Entresto as compared to enalapril therapy after hemodynamically stabilizing patients who were hospitalized for acute decompensated heart failure. So they mentioned the research gap, they mentioned the study objective, they mentioned the study population. That's another way of stating your research gap. The third example is on type 2 diabetes and cognitive decline in middle-aged men and women. So this study mentioned clearly their hypothesis. So first, they mentioned the research gap, saying, yet to study the relation between onset of diabetes and cognitive decline, it is essential to include this group and measure cognitive function longitudinally before and after the onset of diabetes. So this is the gap. And then they mentioned that their hypothesis, that we tested the hypothesis that individuals with prevalent diabetes at baseline and those with incident diabetes during follow-up show a greater decline in cognitive functioning than individuals. So that's their hypothesis they want to test. So there are many ways, and some journals even make it simple and just request a specific format. Please mention the research question, please mention the aim, and please mention your objective. So, for example, in this study also on Entresto, the efficacy and safety of Entresto in the treatment of heart failure, they mentioned that the research question was in patients with heart failure taking Entresto. The question is, are clinical outcomes improved compared with those on standard therapy when all RCT evidence, including unpublished trial evidence, is considered? This was a systematic review. This is the question. The aim of this systematic review is to explore the evidence for the safety and efficacy of this drug on patients or in patients with heart failure. Then they specifically mentioned the objective, that the objective is to synthesize all available RCT evidence compared to usual care or placebo in patients with heart failure, and to determine the estimated clinical benefits and harm. And someone may ask, what's the difference between aim and objective? Aim is more of a general statement, and objective is more specific, specifically describing the aim of the study and the objective of the study. So regarding the third part of the introduction, also some tips and tricks. Keep it short, keep it to the point. Some introductions elaborate too much on the statement and the question, the research question. So describe your research question in just 1 or 2 short sentences. That's more than enough. And be precise, please. Include all variables briefly, just so the reader knows what to expect when they read the rest of the manuscript. It's important to use transition phrases as well. So use transition phrases to mark the transition from the unknown to the research question, such as one words like therefore. So when you mention that, you know that we're going to talk about the research question and accordingly, for example, and short phrases like for this reason or considering this lack of crucial information. So in general tips and tricks related to writing an introduction, it's important to know when to write the introduction section. So please try as much as you can to write the introduction near the end of the first draft. Of course, this differs from one writer to another. However, most writers write it in the end when they have a complete idea and a complete structure for their manuscript. So it's better to have an idea about the content and structure of the paper before elaborating on the introduction. It's also important to use sentences that are attractive yet understandable, because if a reader is confused, they will not continue reading. And I see this a lot. Please do not use fancy, sophisticated words to impress readers. You will not impress them. You will only confuse them, and this confusion will lead them to stop reading a very difficult manuscript. However, in case of reviewers, this also is important, because a reviewer, when they see also fancy and sophisticated words, they tend to delay reviewing. Always remember that a reviewer has a lot of work on his or her plate. So they have to have a simple language manuscript so they can read it quickly and understand it quickly and not spend much time understanding it. And be careful with abbreviations, because many abbreviations will be present in the introduction section. So please do not forget to clearly clarify all the first abbreviations and what they refer to. And references is a very crucial step. References should be, as mentioned, up-to-date references, and they also should be credible references. So if you have a certain scientific claim and it has multiple references, use only one. One is enough, and use the one with most credibility, a higher impact factor. Its journal is indexed in Scopus, or it's in accredited books and others. So always use the more credible references. And please do not oversight and avoid too many references. And we see that a lot. We can see one sentence, and it's a very simple and known sentence, and it's referenced maybe 5 to 7 references. Only one is enough. Do not oversight your references. So be careful as well to be precise and to the point. Please do not be vague and do not be mysterious. And I can tell you thousands of examples of being vague and mysterious. So being vague is like, the role of biologics is very important in autoimmune disease. How is it important? Is it important to eliminate a complication? Is it important for maintenance? Is it important for maintaining quality of life? A lot of descriptions under the word important. And avoid very as much as you can. The word very also does not add much. So it could be mysterious as well. Like, although there are many studies on the role of adalimumab in ulcerative colitis, however, more studies are required. So this is quite mysterious. If there are many studies, why are there? Why is there a need for more studies? So try to be precise, try to be to the point, and don't be vague or mysterious. So I tried as much as I can to stick to the time. So it's about 34 minutes. I just, before beginning discussion and questions and answers, I want everyone attending, especially writers who are writing for the first time, please, during this week, you have a homework, write an introduction, not more than 300 words. And this is about a randomized control trial investigating the efficacy of tocilizumab, which is a monoclonal antibody, in patients with moderate to severe rheumatoid arthritis. And use every step we mentioned and all the tips we mentioned. And please send it to me on my email, moh.salman.md@gmail. And after taking a look, I will give comments on all sent introductions, and just try to help to guide everyone in this. Again, this is general. Be creative. Please don't ask about specifics. This is an introduction section. So be creative in it. If there's a variable you believe it's not clear, assume any assumption from your side and write upon it. This is a mock example. It's not a real example. And please avoid copy pasting from any other source. Write by yourself in your own language, in your own words, so you can learn from your mistakes. And introductions without mistakes, and any manuscript, there is no manuscript without mistakes. So please write in your own words and your language, and take as much time and do your literature search before writing. Next week's topic will begin talking about the methods section of the manuscript, and this is going to be several parts, because we're going to talk also about each part in details, and hopefully it will add much value to you.